probably never heard about. I'm not sure if you've looked into liposuction before. I hadn't until researching for this presentation, and in reality, it warrants its own presentation of its own, which I might do in the future. But for now, I just want to tell you I made a little brief summary on this slide. Some of the shocking information about liposuction, if you're considering it or you know someone who is. In 2006, liposuction was the most common plastic surgery performed, with over 400,000 patients. Studies on both rodents and humans, so it's very thoroughly established that liposuction negatively affects metabolism, creates an increase in visceral fat, metabolic syndrome, and an increase in insulin resistance, possibly leading to type 2 diabetes. Here's the kicker. Liposuction also causes fat to deposit in untreated areas and poses serious risks of structural damage. There was a Colorado study in which participants got liposuction and were monitored following liposuction procedure, and all the fat that came off that was suctioned out of them returned in other places, in which the fat was not suctioned from. The Health Technology Advisory Committee wrote, "Death and disfigurement due to the cosmetic surgical procedure of liposuction should be a matter of serious public concern." But in reality, the public is mostly unaware of this. All right, now we're going to get into 3 studies on red light therapy for treating obesity. This study comes to us from Sao Paulo, Brazil at Federal University in 2015. Researchers tested the effects of near-infrared light on 64 obese women, randomly assigned to one of 2 groups. Group 1 was the exercise, aerobic, and resistance training, plus phototherapy or red light therapy. Group 2 was the exercise training plus no phototherapy. The study took place over a 20-week period during which both groups of obese women underwent exercise training 3 times a week. At the end of each training session, one group of women received the light therapy and the other did not. Exercise and light versus exercise alone. What were the results? Remarkably, the women who received the near-infrared light therapy following exercise doubled the amount of fat loss compared to exercise alone. Additionally, the women in the exercise plus phototherapy group were reported to have a greater increase in skeletal muscle mass than the placebo group. Researchers concluded the following. Our results demonstrated for the first time that phototherapy enhances the physical exercise effects in obese women undergoing weight loss treatment, promoting significant changes. Other studies have reported similar findings in obese people who combined exercise with red light therapy. But even studies that did not include exercise have reported significant fat reduction from red light therapy alone. Here's one of them. Scientists from George Washington University conducted an independent physician-led trial in 2013 to test the ability of red laser light to reduce fat on the waist, hips, and thighs of obese individuals. Laser treatments were administered to 8 obese patients and consisted of 20-minute sessions every second day for 2 weeks. When researchers assessed the patients 3 weeks after the trial began, the results were remarkable. Compared with baseline, a statistically significant 2.99 inch or 7.59 centimeter mean loss was observed at the post-procedure evaluation point. Translation: patients lost 3 inches of fat from their waist, hips, and thighs in just 2 weeks of red light therapy treatment. And one more study. This is red light therapy alone versus obesity. 67 volunteers participated in a 2-week study and participants received red light treatment or a sham treatment. The treatment group received red light 3 times per week for 2 weeks. And 2 weeks later, reduction in circumference of the waist, hips, and thighs were assessed. Here are the results, and I quote from the study. Participants in the treatment group demonstrated an overall reduction in total circumference across all 3 sites of just over 3.5 inches compared with control subjects who revealed a 0.684 inch reduction. I made a little chart here for the waist, hips, and thighs as far as what was lost in the red light therapy treatment group. Waist, participants lost on average 0.98 inches, so about 1 inch from the waist, about 1 inch from the hips, and 0.65 inches from the thighs. 2 weeks, 6 treatments, 3.51 inches lost from red light therapy treatment. So if you compare red light therapy with liposuction, red light therapy has the potential to help you lose 3 inches of fat in 2 weeks. Liposuction, all fat suctioned out will return, and not in the area that it was suctioned from, but in other areas. Side effects. Red light therapy, there have been over 50,000 studies published to date, and not one reported side effect in any of those studies. Side effects of liposuction. Here are just a few: increased fat, metabolic syndrome, insulin resistance, diabetes, bodily deformity, humiliation, and potentially death. If you're wondering how red light therapy works to reduce fat, the answer is pretty simple. By lowering stress hormones in the body, like cortisol and adrenaline, red light therapy increases the body's metabolism, causing it to burn more calories at rest. So the bottom line is foods and medicines that lower stress lead to weight loss. And in fact, the pharmaceutical industry is actually catching up, and they're actually getting a little bit better, because one of the most recent weight loss drugs is called clonidine, and it's an anti-stress, anti-adrenaline drug. So it fits right in with this paradigm that reducing stress leads to weight loss. Now, conversely, if you look at liposuction, it's a pretty traumatic procedure. So you can see how that would increase stress in the body, and you can see how that would lead to increased visceral fat. But as far as red light therapy, it increases your metabolism by removing and downregulating stress hormones. That is how red light therapy can help you eliminate unwanted and unneeded fat.